Hi everyone. In today's lecture, we're going to introduce systematic reviews, what they are, why they matter in healthcare, and how they're done. I'll also briefly explain meta-analysis because the two terms often get used together. By the end, I want you to have one clear takeaway. A systematic review uses explicit scientific methods to find, appraise, and summarize results from similar studies, so we get a high-quality synthesis of the evidence. It's worth saying early on that not all systematic reviews include a meta-analysis. Meta-analysis is the statistical method used to combine data from multiple studies when it makes sense to do so. I'll also mention the Cochrane library because it's one of the most trusted places to find independent, high-quality evidence to support healthcare decisions. Let's start with the basic problem. Information about healthcare is everywhere. It's on news sites, in journals, on social media, and in conversations with patients, colleagues, friends, and family. Yet the constant flow of information does not automatically lead to better decisions. The real challenge is working out what is reliable, what is incomplete, and what is simply wrong. Think about the kinds of questions that come up in everyday practice. Should healthy people take antioxidant supplements to reduce mortality, or are we seeing a marketing story rather than a clinical benefit? Do annual physical exams actually reduce illness and death, or are they more habit than evidence? For women in labor, is it safer to give an epidural early or to wait until later? These are practical questions, and they matter because the decisions affect patients' outcomes and resources. You can usually find a study or a headline that claims to answer any of these questions. The problem is that single studies can be misleading. Chance plays a role. Study quality varies. Outcomes are chosen differently. Some results get published more readily than others. On top of that, media reporting often cherry-picks findings, and the message changes as it moves from the scientific paper to the headline to the social post. That cycle is one reason clinicians and patients can end up confused, even when good evidence exists. So the question becomes, how do we get trustworthy answers that reflect the totality of evidence rather than isolated findings? This is where systematic reviews become so useful. A systematic review focuses on a specific question and then uses a planned, transparent, and reproducible method to identify all relevant studies, select the ones that meet predefined criteria, assess their quality, and then synthesize the results. The aim is to reduce bias and give a balanced summary of what the evidence actually shows. Let's walk through a couple of examples, because examples make this real. First, the timing of epidural analgesia in labor. For a long time, there was a belief that giving an epidural early could slow labor or increase the risk of cesarean section. Different studies reported different effects and practice varied. A large Cochrane systematic review addressed the question by combining data from multiple clinical trials involving more than 15,000 women. In those trials, women were randomly allocated to early epidural or late epidural groups. When the evidence was pooled and assessed carefully, the conclusion was clear. Early epidural did not increase the cesarean section rate compared with late epidural. It did not increase the likelihood of assisted vaginal birth with forceps or suction. It did not meaningfully prolong the pushing stage. In simple terms, the best timing is when the woman asks for pain relief. The systematic review helped to settle an argument that individual studies could not fully resolve on their own. Now consider annual physical checkups. Many people assume that routine yearly health checks must reduce illness and death. It feels intuitive. Catch things early. Prevent problems. Yet a Cochrane systematic review examined this by analyzing 14 randomized trials, including more than 180,000 participants. This is a substantial evidence base, and it allows a more reliable conclusion than any single trial. The review found that routine general health checks did not reduce overall mortality. There was no reduction in deaths from cancer or cardiovascular disease either. So on the outcomes most patients care about, living longer and avoiding major disease, annual physicals showed no benefit on average. Interestingly, the review did find that health checks increased the number of diagnoses such as hypertension and hypercholesterolemia. That can sound like a positive result, but it raises the issue of overdiagnosis and downstream harms. More diagnosis can mean more follow-up tests and procedures, some of which carry risks. It can lead to overtreatment in people who would never have developed symptoms. Psychological stress can also occur, especially after abnormal results that later prove to be false alarms. The systematic review concluded that, from a health perspective, routine annual physicals for generally healthy adults are not clearly beneficial and skipping them is reasonable. It's a counterintuitive finding and it highlights a key point. More healthcare does not always mean better healthcare, and evidence can challenge long standing routines. After seeing examples like these, it becomes easier to understand why systematic reviews are so highly valued. They compile data from many studies and provide an answer that is less vulnerable to the noise, bias, and inconsistency you see when you rely on individual papers. So, what exactly is a systematic review? It's a type of research study in its own right. You can think of it as research on research. It begins with a clearly formulated question. Then it follows explicit methods to identify, select, and critically appraise all relevant studies. Data are extracted systematically and then analyzed. Because the process is planned and transparent, a well conducted systematic review aims to provide a comprehensive and unbiased summary of what is known. If you want the core components in plain language, they are these. First, you identify all evidence relevant to the question through a comprehensive search, often across multiple databases and trial registries, and sometimes including unpublished data. Second, you select studies using predefined criteria, not by preference. Third, you appraise the quality of each study by assessing risk of bias, which matters because a biased study can pull conclusions in the wrong direction. Fourth, you synthesize the findings. That synthesis may be qualitative, which means summarizing patterns and results in words, or it may be quantitative, which is where meta-analysis comes in. Meta-analysis is the statistical method used to pool results from multiple studies to give an overall estimate of effect size. Not every systematic review includes a meta-analysis. Sometimes the studies are too different in their design, populations, interventions, or outcomes. Sometimes the reporting is not good enough. Sometimes there are simply too few studies. What makes the review systematic is not the presence of meta-analysis. It is the pre-planned, explicit method that aims to find and evaluate all the evidence fairly. This brings us to the difference between systematic reviews and narrative reviews. Narrative reviews are the traditional style many of us encountered early in training. You gather studies, discuss them, and present a story. The issue is that narrative reviews often do not have a protocol. The search strategy may be unclear or incomplete. Inclusion and exclusion criteria are not always stated. Quality assessment may be inconsistent or absent. As a result, narrative reviews can be influenced by the author's viewpoint and can unintentionally cherry-pick evidence. Historically, this created real problems in medicine because clinicians relied on reviews that seemed authoritative but were not always balanced or reproducible. In contrast, systematic reviews were developed to bring rigor and transparency to evidence synthesis. The methods are described clearly so another team could replicate the process and arrive at the same set of included studies and similar conclusions. That reproducibility is not just academic. It is what makes systematic reviews more trustworthy. Now let's talk about how systematic reviews are conducted in practice, because understanding the workflow helps you interpret the final product. The work starts with building a team. It's rarely a one-person project. You typically need content experts who understand the clinical context and methods experts who know systematic searching, study appraisal, and synthesis. More than one reviewer is essential because it reduces bias and errors, especially during screening and data extraction. Next comes the research question. A focus question is everything. Many teams use PICO, meaning population, intervention, comparison, and outcome, because it forces clarity. It also helps decide which studies to include and which outcomes matter. At this stage, good practice includes input from stakeholders. That might be clinicians, patients, policymakers, or service users, depending on the review's purpose. Declaring conflicts of interest early also matters because bias can creep in through funding, affiliations, or strong prior beliefs. Then you write the protocol. This is a defining feature of systematic review work. The protocol is a detailed plan written before you start analyzing results. It specifies databases to search, search terms, inclusion and exclusion criteria. outcomes, study designs, risk of bias tools, and the plan for synthesis. Many teams register protocols on platforms like Prospero to improve transparency and prevent selective reporting. The protocol is basically a commitment to a method, so the review does not change direction based on what the results look like. After the protocol, the team performs a comprehensive literature search. This usually includes multiple bibliographic databases such as PubMed or Medline, Embus, and trial registries. The aim is to identify all relevant studies, not just those that are easy to find. Reference lists are checked. Conference abstracts may be screened. Unpublished data may be sought when appropriate because publication bias is a real concern. Screening comes next. Titles and abstracts are reviewed first, and then full texts are assessed against the inclusion criteria. Ideally, two reviewers do this independently, and disagreements are resolved by discussion or by a third reviewer. This reduces selection bias and improves consistency. Then the team extracts data. Key features of each study are recorded in a standardized way. At the same time, risk of bias is assessed using established tools, especially for clinical trials. Issues like randomization, blinding, missing data, and selective outcome reporting matter because they affect how much weight you can place on each study's findings. Again, independent duplicate extraction is common to reduce errors. After that, the evidence is synthesized. If the studies are sufficiently similar, a meta-analysis may be performed. That involves pooling effect estimates using appropriate models and checking heterogeneity, meaning the degree to which results vary across studies. Forest plots are often used to visualize individual study effects and the pooled estimate. If meta-analysis isn't appropriate, the review will still synthesize findings narratively, describing patterns and differences and explaining why pooling was not done. Many systematic reviews also use grade to rate the certainty of evidence for each outcome, which helps clinicians understand how confident they should be in the conclusions. Once the synthesis is done, the findings are interpreted in context. A good systematic review will be careful about limitations. It will explain uncertainty, potential bias, and where evidence is thin. The reporting is written up with enough detail that readers can follow the methods and judge credibility. One of the strengths of systematic reviews is that they can be updated. If new studies are published in future, the review can be refreshed using the same protocol and methods, which is especially valuable in fast-moving fields. So how does all of this connect to evidence-based healthcare? Evidence-based practice is commonly described as the integration of best available research evidence with clinical expertise and patient values. Systematic reviews strengthen the research evidence part of that triangle. They do not replace clinical judgment. They do not replace shared decision making. Instead, they provide a clearer view of what the evidence says, so clinicians can apply it intelligently and ethically to individual patients. This has wider implications for health systems too. Healthcare spending is high, and a substantial proportion of spending is wasted on interventions that do not improve outcomes or that cause harm through overuse. Evidence-based healthcare aims to reduce that waste by focusing care on what is effective and avoiding low-value practice. Systematic reviews help identify both. They can show that an intervention is beneficial and should be adopted, or that a routine practice offers little benefit and may need to be reconsidered. You might also hear the term comparative effectiveness research. This is closely related. It focuses on comparing meaningful alternatives, not just intervention versus placebo, but one real option against another. In the United States, the Patient-Centered Outcomes Research Institute PCORI was established to support patient-centered comparative effectiveness research. The emphasis is on outcomes that matter to patients and clinicians and on producing evidence that can actually guide choices in the real world. Systematic reviews and evidence synthesis are part of that ecosystem because you often need to summarize what is already known before deciding what new research is needed. Before we close, I want to mention one practical point. If you want a reliable starting place for systematic reviews in healthcare, the Cochrane Library is a key resource. Cochrane reviews are known for rigorous methods, transparent protocols, and regular updating. They are widely used to inform guidelines and policy, and they are often a first stop for clinicians who want trustworthy summaries of evidence. To finish, systematic reviews and meta-analysis are essential tools in modern healthcare. They help us make sense of a huge volume of research, reduce the risk of being misled by isolated studies, and support better clinical decisions. In the next session, we can focus more closely on meta-analysis itself, how pooled effects are calculated, and what to watch for when interpreting forest plots and heterogeneity. Thanks for listening. I hope this gives you a clear, practical understanding of what systematic reviews are, why they matter, and how they fit into evidence-based care.